Acromioclavicular joint is dash variety of synovial joint. Guess the answer. So here you are seeing is an image of both the joints at the two ends of the clavicle. Medially you have this joint called sternoclavicular joint. The sternoclavicular joint is what variety of joint? This is a saddle variety of synovial joint. As well as it's a complex joint. And because of the presence of this intra-articular disc, this joint space has been divided into two compartments. Here you're seeing is this compartment. This is the medial and superior, you can say supromedial compartment, right, towards the manubrium. And in this compartment, the movement that is permissible is protraction and retraction. Means the clavicle can glide in forward and backward direction in this supromedial compartment. Then there is this compartment here which is towards the clavicular end. This is infralateral compartment, right? So in this infralateral compartment, the movement that occurs is elevation and depression and rotation, right? So that means you can move the clavicle upwards and downwards over to the manubrium in this compartment, right? And apart from elevation and depression, there is also a twisting movement possible here. Like when you are doing bowling in a cricket, that means circumduction movements at shoulder joint. So there is also a slight rotatory movements possible. Remember that this is a saddle joint. So not only the movements happening in the two directions, vertical axis and transverse axis. Apart from that, there are rotatory movements also permissible, right? That's along the longitudinal axis. Now this rotatory movement, the clavicle, are also happening here in this infralateral compartment. So remember this: supromedial compartment, protraction and retraction; infralateral compartment, elevation, depression and rotation. How to remember this? Have you heard of that pump handle movement of the sternum for increasing the AP diameter of the thorax, which involves the upper 2 to 6 ribs, right? So because it's towards the sternal end, right? So remember, protraction and retraction will happen in a compartment which is towards the sternum. And have you heard of elevating and depressing the shoulder joint? Right? So remember, elevation and depression will happen in a compartment which is on the lateral side. Forward movement and backwards, that's protraction and retraction, will happen in a medial compartment. Right? This way, I believe you can remember. And furthermore, if you abduct your arm at an angle of around 90 degrees along the longitudinal axis of the clavicle, and then you start twisting your upper limb, right? So that's the rotatory movement happening, and which provides adjunct rotation at the medial end of the clavicle. So this also you are doing with the help of bones lateral to the clavicle. So that's why remember, rotatory movements will also happen in the lateral compartment, right? Okay. Then on the lateral end you find is another joint called acromioclavicular joint. This joint is a peculiar joint as it has some peculiar features. One thing is about the variety. So this is a plain variety synovial joint. Both these joints, they have their intra-articular disc, and that's why this also is a complex joint. But the important point here is that this intra-articular disc here in this joint is perforated. So the joint cavity is not separated out, unlike the sternoclavicular joint. Another important fact about this is, which is a peculiar thing about this joint, because as you know, synovial joints have three criteria to be fulfilled. One thing is that the articular surfaces should be lined by an hyaline cartilage, which is devoid of perichondrium, and that's called articular cartilage. Second thing is that the joint space should be covered from all the sides by a fibrous capsule. And the third thing is the cavity of the joint has a lubricating fluid covered by a membrane, and that's called synovial fluid. So these three criteria for a joint to be called a synovial joint. But here important point is that this acromioclavicular joint, this articular surfaces both the sides, this is not a hyaline cartilage, this is made up of fibrocartilage. These are important points to remember about the acromioclavicular joint. Similar such situation you will find in TMJ, temporomandibular joint. There also the articular cartilage is not hyaline cartilage, that also is a fibrocartilage on both the surfaces. And TMJ, is a condylar joint. More peculiar thing which you'll find is in sacroiliac joint. Now in sacroiliac joint, the two reciprocating concavo-convex surface, the articular surface of the sacrum has a slight concavity and the articular surface of the ilium has a slight convexity. So that provides a better grip, and the shape of the two reciprocating articular surfaces on the two bones is either L-shaped or auricle shaped. So we call this as auricular surface or boomerang shaped. But the important thing is that the two surfaces here in this joint is covered or lined by a different cartilage. On ilium, the articular surface is covered by a fibrocartilage. Remember, a smooth bone covered by a rough cartilage. And sacrum, which is a rough bone, is covered by a smooth cartilage, that's hyaline cartilage. So remember this, the in sacroiliac joint, the two surfaces are having different types of articular cartilages, and the sacroiliac joint is also a plain variety of synovial joint. So these are some important points you should remember. MCQs can be made on these points. Answer here is that acromioclavicular joint is a plain variety of synovial joint.